Hey guys, welcome back to Bubble Burst, and today I'm going to be showing you what is in Sterile IV Start Kit, and I'm also going to be showing you how to find a vein and insert an IV. So without further ado, let's get started. So first off, sorry, you may hear a lot of rolling around. I thought this would be better than the yoga ball. I likely will switch to the yoga ball. But for now, this is the IV Start Kit itself. It comes in a bag. And then I'll show you what's in it because I can't hold everything up, roll around, hold everything up. So I am going to switch to my ball. Sorry guys. I really like to make it so you can see everything and not be hearing bouncing in the background, but it gets tricky. So there's an extension set. Has a clamp at the bottom, a cap, and I just attached the flush to the tubing. You never really want to keep contaminated supplies in your sterile supplies. So I will go ahead and discard that. Sorry guys, that's just my stool again. As I mentioned, yeah. So, a lot of times you'll see sterile IV kits where everything's laid out and you just see like what you need to insert everything. Well, I'm going to show you what you need and how to insert it because I decided that would be a better thing to do. Sorry, just trying to move things around so you can see. Just getting a piece of gum for myself because I just finished lunch. Alright, back to the vlog. Sorry. There. Now the camera's angled upward more. That's better. Alright. So first off, we have IV extension tubing. You want to get this primed. You do it like so by opening the little white clamp at the bottom. Obviously, every extension tubing is going to have a spot where you hook in your syringe. This was just fresh opened out of the package. Otherwise, I would have cleaned it with an alcohol wipe, which comes in our IV Start Kit. Okay. Alright, I showed you the extension set because my patient will be getting hooked up to one once their IV's in. I wrap it in a nice little sterile fashion here. Okay. We're getting into the meat and gravy now. The meat and potatoes. We have a flush. Right, because flushing the IV is always important. Once you get it, you want to make sure you flush. we actually have the actual catheter itself. It's so small, it literally looks like this, guys. So it's a little, it has a slit in the top, and that slit goes at the top of your insertion spot because you want a nice round area at the bottom to insert your access needle, because that's how we do it here. So this is still in packaging. Can I just measure your arm, sweetie? Nothing's happening yet. So I'm thinking that will go in the middle of her arm. That's the IV itself. I have two different syringes with needles. I don't think it matters which one you use, but if you want lab work, I recommend the bigger syringe, especially if you're catheterizing a bigger vein. This is what you're gonna see here. And then obviously has the plunger at the top. So you have that. I am using sterile techniques, so all of this is staying sterile. As I mentioned, it comes with 2 needles in case you miss. You have a second try. You do not have a second catheter, so you'll have to go get one. But in case maybe you need an injection, they do give you a small needle with a small syringe. It's a 3 ml syringe, so it's super tiny. And this is what it looks like. My hand's in the way, so you can't see it all, but if I wasn't holding it, you wouldn't be able to see it. So that is that. I don't know which one I'm going to use yet, guys, but that's... Oh, man. Please excuse that. That is just my dogs. I'm at home while making this video. Let me get the non-sterile components out of here. Guys, there are some sterile components that do have to stay sterile, so I'm putting those back in the kit. But there's tape, a tourniquet, and gloves that can be non-sterile. But there are some other needles and stuff in here. Obviously, tape, right? We don't want that IV going anywhere. And I have scissors to cut the tape because it's not on a handy-dandy dispenser. Although, I do have a handy-dandy dispenser, I think. So let me see. Unless I threw it away. Okay, guys, I may have to cut this. I'm not seeing the dispenser. It is a little bit of a pain in the butt to cut. So, now, this is my strategy for tape cutting. Cut there. Ah! Phew. I didn't cut when I didn't want to cut. So, this is my piece of tape. I'll have more, I'm sure. But when you get it, you want a piece to be taped down and ready to go. So that's why I always cut myself a piece, so I can just grab it and pull it and go put the patient's IV in. It is medical tape. Let me see if I can do this aseptically without sterilizing. Without de-sterilizing and without pulling all of them out. Okay, there we go. I was about to say, guys, I don't know. It comes with a couple of them, because, you know, never know. But this is an alcohol wipe, because when you get it, you're going to clean, and then you're going to poke. And then once you have it, you can even prepare your catheter with your piece of tape on it. But you want to verify that's where you want it before taping. So this is the alcohol swab. It's in blue packaging, as always. Because I've already taken this one out, I'm going to leave it next to my tape piece. So there are some things you can see. Alright. So, let's get the IV process started after I finish showing you. We have this super long tourniquet that we put on, which I'll actually put on now. So that, excuse me. So that when it's ready to go, see it's already popping up some veins. Not my favorite item, but I have gloves. And then I also have hand sanitizer. And then a numbing for my patient so they don't have to feel the needle poke them. Which is, it's small, it's not huge. But there is a huge drawing up one in there that I didn't want to show you because it might freak you guys out. It's huge. Okay. So I'm going to get ready to go. I want to prepare myself a little work area. I'm going to put this above my sterile field. That way I can allow myself to have everything ready. Alright. I am going to go for the 10 ml needle because I am doing a bigger vein, which will make more challenging if you use a smaller syringe and you need to pull out blood. I'm also getting my catheter ready. So that once I have it, I can tape it. Alright. So I spot my vein. You don't have to clean for this part. Gave my numbing so the patient won't be able to feel anything. All right. Now, grab your swab out of the package, whatever you use. I'm just cleaning the whole site. Okay. I'm gonna leave the tourniquet on and let the alcohol dry. Where did that garbage go? There it is. Don't leave yourself garbage to clean afterwards because it's not easy. Alright. We are ready to go ahead and get that IV. So I'm going to put my needle in here. I'm going to pull up. I'm going to leave that right there. And you want to ask your patient not to move now that you have it. It'll slip from you very easily if you don't have it. I think I took it out. What? I'll just grab another one. You can lose your angio cap, which is why I recommend having a couple. Just in case, and we'll go with the smaller one. It's the same thing, so I'm not going to show it to you guys. But I'll be able to get it a bit easier. Now I'm going to get my piece of tape that I cut earlier. I know, that's a really yucky sound to hear the tape being peeled off the table. That makes it super easy, so that when you're ready, all you have to do is go boom, boom, your IV is in, and then I always do a flush before I secure it. Oh, silly me. That's okay. Now the IV won't be as big. I did find my other catheter, but I'm going to use the smaller one because I already have it in there. Now, I have it, so I'm going to verify I have it. There's actually another needle in here you can use, that's why they give you two. To either give yourself a second chance or to confirm you have your IV. So take off your white cap on your flush. Hopefully you primed this already. You do have to be careful because it's on pretty loose. Yep, we got it. So we'll secure it down. So now, gonna cut another piece of tape. If I can unpeel it. Let's find where it unpeels, guys. Oh no. Should have did this earlier. Well, it's not gonna go anywhere for the time being. So I think I sometimes use Band-Aids to hold mine down. Here we go. And about the same piece is what we want. And I'm going to use my tactic again of sticking half of it down and leaving half of it up. It actually makes it super easy to cut. And then I'm going to open the scissors. And remove it. I like to put 3 to 4 pieces of tape just so it doesn't go away. Because if it runs away, you have a big mess. I'm going to come in from the same angle on this side, except I'm going to see with more and more tape, it comes more secure. So the more tape you put, the less chances you have of it running away. So I'm gonna get 2 more because I'm gonna do 4 pieces, like I said. Guys, if you're gonna peel tape, you have to have really good nails. This video will be kind of long, and I apologize. Oh. But if you don't want to see this part, me trying to cut tape, you can skip ahead. And we'll stick half of it down once I can get it off my finger. And boom! Guys, because it's a flat roll of tape, you just put it down and then you cut the edge. But be careful not to cut your hands. And notice I go for my same angle point again. And I go for my same other point. Alright, one last piece just for good luck, and then hopefully it won't roll away. Looks like I've got it pretty good though. And then the tape can go in our normal needle bin because I use it as Band-Aids too. Or to tape the gauze to hold pressure and whatnot. I did not film this to show you how to cut tape, I promise. You will get to see my finished product. I'm just in the midst of inserting it still. Alright, last piece of tape, and then we'll put the other part of the IV on, which is the access point. I know. Did I do this wrong? Nope. And all I'm doing is following my same point, but you don't want it too secure. So we've got it secured good. Alright. I only sat down for that part because I knew it was going to be kind of long and I wanted to make sure that I didn't hurt myself by moving and cutting. So, thank you. And my blade of my scissor is clean. Amazingly, it didn't get all sticky. So back in the needle bin that goes. And now we're going to hook up, not the flush needle, we're going to hook up. Now you want to make sure you have room to hook up as well, because if it's too secure, alright, now you want to leave the needle on and you're taking the syringe away. Because that's how we do it here. Now Now you can go ahead and discard all of this. We will use the extension set at a later date. I just don't want this video to be insanely long for you guys. But that really is an essential thing in the kit. And then I also have a drawing up needle in there so that I can draw up medications if needed or fluids. But currently I'm about to do a cap. So I take the needle out, pull it out, but you want to make sure if it's a one catheter IV, that's okay. But sometimes you have two catheters running and it's not easy to do. Wow guys, this needle does not like me. Okay, got it on. It's important you do that because you want your patient's IV to remain safe. And now all you're left with is the cap. Alright guys, Miss Sadie wants to show you her IV, so we're going to let her. This is the IV on the patient. I should have done it on the desk since that's where I was filming, but I have my 4 pieces of tape. One's slightly on her finger, but it's not restricting anything. She just has that little cap dangling there for now. She just got admitted, and that's typically what we do to our patients is we'll just cap their IV because we don't have orders to do anything. All right. Go ahead, Miss Sadie. You're free to go to your bed. And then one thing we'll make sure of is that the patient is in their bed. And that they're comfortable. And I also have to do cleanup afterwards. And then I'll stop vlogging because I don't want this video to be insanely long again because YouTube might give me problems uploading. I don't want you guys to see it. I don't sit here and film for nothing. I do want you to know that in certain sterile procedures, we are allowed to sanitize our hands. And that's why I didn't use the gloves. Because gloves and tape don't mix well, so I just decided to sanitize. But I do want you to know that we do use gloves. And then, wow, I think I took more swabs than I realized. I took 4 extra alcohol swabs, oh my god. And then if you wind up with extra products, you don't have to throw them away. You can save them as long as they're unopened, which I just restocked the alcohol wipe situation because we didn't have any. So this, I'm just adding this brief little part. That's a drawing up needle. It's long. Alright, thanks guys. If you want to see more videos like this, remember to like, share, comment, and subscribe, and also click that notification bell. Bye guys!